recording. Alrighty. Hello, everybody. Thank you so much for joining us. This is a lunch and learn on the 988 hotline and Caring Contact. So Mary Claire is the executive director of Caring Contact. So she has a lot of experience, with the calls that are coming in, as well as, working with the folks who are calling the hotline and the warm line. And then she's going to give an overview just about the program in general, kind of like what you can expect when you call 988, as well as just, other resources and trainings that the program does. So it's a great presentation, and I hope that everybody gets a lot out of it for today. So Mary Claire, I'm going to pass it over to you if you want to start sharing your screen, and if you want to do a quick like self intro too, you're more than welcome to.
Can everybody see that? Oop, nope.
No, we can't see a
Okay.
presentation.
Okay, one second. Oh, now it's disappeared. Hmm, 1 second. You're my witnesses. You saw it before.
Yes, Shara and I did indeed see this successfully present.
Let me reset the sharing option.
Oh,
Hold
yeah,
on.
I that.
Yeah. Can you see that?
Mm-mm. Is it because there's a spotlight on the
No, it
screen?
should work even if there is a spotlight. Give me a hot second.
Okay, thanks, Shira.
One
Yeah.
time I did a presentation like this and I went through, I think 75% before anybody said, oh,
You
by the
can't see the
way, we
presentation.
can't see your presentation. They were so light and so lovely, but it kind of defeats the purpose. So, um,
Oh, there we go. Hold on.
and I have a tech person here that if we can't make it work.
Or I can try sharing the presentation too, and then you just tell me when you want me to move to the next slide. Maybe
Let
that
me
could
give it
work.
one more try, and if I can't get it to work, we will do that because I don't want to take up everybody's time here.
Okay, let me see. Hold on, I have it pulled up here.
Oh, I got it.
Oh, hold on, let's see. Perfect.
Hey, I'm a winner.
Great. Okay, I'll pass it over to you, Mary Claire.
Thanks. Good morning, everyone, or afternoon, I guess, at this point. Thank you so much for coming today, and I really appreciate your time and coming and being here with us. My name is Mary Claire Gavelber. I am the Executive Director of Caring Contact. Um, Caring Contact is an organization. We are physically located in Union County, and we're actually celebrating our 50th anniversary this year. So since 1975, we've been serving people who are in emotional distress. We've done that through two different numbers. One, which was started in 1975, that's what we call our warm line, which is a place where people can call who are just simply struggling and need somebody to talk to. We do occasionally get calls on that line from people who are having thoughts of suicide, but it's primarily a place where people call to check in. They may have a situation that they feel is escalating, and this gives them an opportunity to be heard and to de escalate. We also answer the National Suicide Prevention Lifeline, which is now 988. And if we were in a group together, I'd say, raise your hand and let me know if you've heard of 988 before. There used to be a 10-digit number prior to 2022, where one could reach the National Suicide Prevention Lifeline. And Congress decided in 2019 that it made a lot more sense for people in crisis to call a 3-digit number, similar to 911. So 988 was launched. And so for the past 20 years, we've been participating in that national network. Across the country, there are about 200 centers that answer those 988 calls. And we are one of the 4 agencies here in the state of New Jersey doing that. We do this work primarily with volunteers. So before the launch of 988, we did it entirely with volunteers. And because of the growth and volume of calls coming in through 988, we now have some paid part-time listeners who are doing that work with us as well. They were all formerly volunteers, so they've gone through the same training process. We have 9 staff members, including myself. I'm the only full-time person here who are doing the training, the support, the community outreach, the fundraising, everything that goes along with running a nonprofit organization. We answer people who are calls from people who are struggling, in crisis, and possibly thinking about suicide. This is a non-judgmental space. We look for people who are empathic, who can sit in a hole with someone, perhaps on their darkest day, and provide a space for them to be heard. And if they are having thoughts of suicide, for us to ensure their safety. Like today, we provide various different trainings to community groups and organizations who are looking to learn more. So what is the 988 Suicide and Crisis Lifeline? Again, there are about 200 different organizations nationwide, some like Caring Contacts, small nonprofits, up and through state-run agencies that are answering 988. It's available to anyone who is having suicidal crisis or is in emotional distress, and the service is free. Calls are now routed according to one's location. So they're geo-routed, not geolocation, but geo-routed. The difference being a tower gets pinged and your call gets directed because you're in Union County, or you're in Passaic County, or because you're in Bergen County. Those are counties that we answer calls for. Previously, everything was done according to area code, and it created an issue where if you took your cell phone and you moved to California and you called 988, we were answering that call here in the state of New Jersey. And while we can do that work, and we successfully for years did that work with people calling us from other parts of the country, it simply makes more sense to support people who are in our local communities in case they need resources or in case they do need emergency services. 988 calls are always answered. We are an organization that operates 7 days a week, but we are not 24 hours a day. If you call 988 and we are not here, it goes to our backup, which is Rutgers Behavioral Health. And if for some reason Rutgers can't grab that call, there is a national backup. So 988 calls are always, always answered. Last year, in 2024, we answered over 13,000 calls to 988. So what's the difference between 988 and our warm line? Again, our warm line is a place for people to call who are experiencing a whole host of different issues. Same thing for 988. We get calls from people with all sorts of different issues, but they mainly focus on anxiety, depression, grief, physical ailments, things that people in their lives are perhaps tired of hearing about. You know, we have callers who call here every single day, and oftentimes it's the same story over and over again. So to have a space where you can call, where somebody isn't going to judge you, someone isn't going to tell you, oh, you told me that story yesterday. We are going to hear them. We're going to help them find a sense of calm so they can then go on with their day. And also sometimes people do call us because they're intimidated about calling the national number. We are a local organization, and so some people just feel a sense of comfort in knowing that it is being answered by folks who live in their community. Our volunteers and our paid part-time people answer both lines. So if you call, the training that those folks have received is identical. So if we do get a call on the warm line with somebody who is having suicidal ideation, we are able to help them and not have to refer them to 988. I'm going to stop for a second. Are there, Shira, if people have questions while I'm speaking and they want to put them in the chat, please feel free to interrupt me. I'm happy to answer questions as we go along, or we can wait till the end. So who are our listeners? Similar to our callers, they are everybody. Well, let me back up. We're not physicians, we're not therapists, we're not mental health professionals. I have a background in public policy. I have a master's in public policy, yet I am a trained crisis line responder. I went through the same training that all of my volunteers and paid part-time people went through. And these are people like you and me. We have bankers and lawyers and teachers and nurses and stay-at-home parents, retirees, some college students, but they come from all different backgrounds. They come from all different communities in the 7 counties that we represent. They're younger. You have to be 21, but we also have, I think we have probably a half dozen listeners who are well into their 70s and early 80s. We are culturally diverse, and most importantly, we are people who are empathic. We are willing, again, to sit with you in a hole and hear your story and not judge anything that you share with us. Our volunteers receive over 50 hours of training, and then that training is mostly in active listening. And then the other training component is something called ASSIST, which is Applied Suicide Intervention Skills Training. This is an internationally recognized evidence-based program that helps people who are having thoughts of suicide remain safe. It does not diagnose them. It does not create a treatment plan for them. That is not our job. Our job is not to fix anyone. Our job is to help a person who's having an irrational thought stay safe for now. Oftentimes, people who have thoughts of suicide walk around for years having thoughts of suicide and never act on it. And so we need to create a space for them where we can listen to them and listen to that story and not judge that fact. So why do people call us? It's an endless list. Again, people who are lonely, anxious, depressed. We get a lot of students who are calling, who are worried about school, who are worried about relationships. We have a lot of elderly people call who are at that point in their life where they are grieving the loss of independence, the loss of loved ones, the loss of physical abilities. We have people who call us who do have true mental health or physical concerns. We have people who call us who are experiencing domestic violence. We get a lot of what we call third-party calls, which are people who are simply worried about someone else, a parent who's worried about their child, a husband who's worried about his wife. We have students calling about other students. So it really just goes, you name it, I'm sure that those individuals have called us. And what we do is we provide a space for them to, again, as you can imagine, if your child is, has gone to a place where they're not being responsive anymore and you're worried about their safety and you don't know how to ask the questions around suicide, that's incredibly stressful and scary. And so we provide a space to hear where you are and to also provide you with some words that you could use, some strategies you could use to engage with your child or your friend or your spouse or whoever that person is to help them remain safe. So what happens when you call? Calls are confidential, but they are not anonymous. People, especially young people, worry that when they call, they're going to get in trouble, that we're going to call their parents, that we're going to call the police, their school. I need you to know that we never share information that is shared with us on the crisis line. The police need to have a court order in order for us to release that information to them. So it is, again, it is confidential. We do have caller ID, and we do have that, we do collect that piece of information in the event that the person calling us is unable to stay safe, that they cannot come up with a plan where their safety is put first. I want you to know that out of the calls we took last year, between the 988 number and the warm line, we answered over 21,000 calls. We only called out 52 times to emergency services. And 47 of those times we called out with permission from the person who called us. You don't have to share really anything about yourself. If you want to call and just tell your story, that's all you have to share with us. You don't want to share your name, you don't have to share your name. You can just say, I want you to call me Sally today. Or you can say, I don't even want you to refer to me as anything today. The most important thing is that we want people to know that this is their time. And I'm not going to direct your story or start asking you all sorts of questions. We have no agenda except to know, for you to know that this is a space that is safe and that we will work with you to create a plan if needed for you to stay safe. And again, if you don't like the way the conversation is going, you can hang up and we will not call you back. These are a couple numbers for you to be aware of. The first is 988. You can call that anywhere in the United States and be connected with a counselor. And then the second number is our warm line. That number, again, we prioritize 988. So if two calls are coming in and one is a crisis line call, the 988, we are going to prioritize that call over the warm line. I suggest to people when I share this screen, and I know Gina said that she would also share it with you, to maybe take your phone out and take a picture so you can have that with you. Again, the beauty of it now being 988 instead of 1-800-273-8255, which was the number you had to remember before. It certainly does make it easier, but I would really love for people to have our warm line number. It is just a wonderful place for people, for you to share with people, either use it yourself or share with people that this is an opportunity and a place for them to reach out. I'm going to stop sharing my screen. I'm going to take a little drink of water. And I'm happy to answer any questions. It's a lot of information in a couple minutes. But I'm happy to answer any questions you may have.
So there's a couple of questions in the chat that we got during the presentation. The first one asks, does Caring Contact or the state of New Jersey collect data on number of interpretation used and or the ethnic/racial background of the caller?
The state of New Jersey would like us to collect as many data points as possible. It's not what we do as an organization. meaning um, I'm not going to ask you what your ethnicity is. I'm not going to ask you what your age is. I'm not going to ask you what your gender is. If during the course of a conversation you share that information with me, we will put that into, we have a web-based program where we collect information about calls. And we do that mostly so if somebody calls us and they call back, we have the ability to refer back to that conversation. And it's just helpful for somebody who is struggling for us to be able to do that. Um, so the state of New Jersey each month wants to know who called us, from which counties, how many times we sent out emergency services, um, general reasons for why people called. Um, they want to know what languages people are speaking when they call. Um, and if we happen to collect that information, we share that with them. But we, as an organization, aren't going to, we don't have a checklist. We're not going through and asking those questions.
Great. Thank you so much. I'm going to take Daniel's question because he has his hand up, and then afterwards I will ask Danielle's. So, Daniel, if you want to go ahead and unmute.
Hi, thanks for doing this. It's pretty important. I am a councilman in my town of Tenafly, so I'm putting on my government hat.
Oh,
Um, so when you take the 988 calls, I'm gonna assume it's just like it routes to a cell phone for a volunteer, and then they're doing their thing with the caller, and then you are connecting, if needed, you are connecting them to a 911 service.
sure. So the way that it would work is calls come into 988 and they are geo-routed to our center. So we have approximately 105 individuals who are doing this work with us. About a third of them have the capability to do that work from their homes.
Okay.
So and that was a product of COVID, right?
Right.
We deemed essential, and so up until then, we had never done that before. So it has helped us have better coverage. It has helped us with our retention with volunteers, and that to be able to go into a private room in your house where you know you have good cell phone service. Those are all
Of
things that
course. Of
require
course.
for that to happen. Um, the person takes these private calls, and if during that conversation a person the person has requested that emergency services come to them, we have a separate phone where we can call out to emergency services and set that up. What we do with our volunteers is they stay on the line. If the caller requests it, they will stay on the line with them until emergency services arrives. And then we ask them to hand the phone to the officer so we can have a conversation with them and bring them up to speed on what is going on. If the person
Gotcha.
um, is clearly unable to stay safe, if they've made statements about having that they're at imminent risk, um, and they have shared where they are, then we will call that police office, that dispatch center, and let them know what's going on, any information that we've collected about the caller and the situation, and they will dispatch emergency services. Oftentimes we have people who call us and they make statements where, you know, they say, I've gone to the train station and I've decided that this is the day. And we've had a conversation with them and they hang up and we don't know which which train station, we don't know where they are. All we have is their phone number. We work closely. Our center happens to be located in Westfield, New Jersey. We have a really great working relationship with the Westfield Police Department. We call them, we say this is the person's phone number, and then they can actively go and try and find that individual and keep them safe. Does that answer your question?
Yes, actually it does. It's just I was curious about the workflow or the call flow of how
Sure.
that worked because obviously you're the quote unquote the first responder in this situation
Yeah.
where you have to play catch up with police officer or whoever's responding. And if they
Right.
have a mental crisis response team as well, it obviously just doubling up on something important.
Yeah. Because
The response is appropriate at that level.
right. And a lot of towns now have the Arrive First program, which
Yes,
is
arrive together.
Arrive Together, I'm sorry, um, which is not part of 988. So I can't call dispatch and ask them to send out Arrive Together. But we do know of cases where the instances where we have called police that they have told us that they are going to send out Arrive Together,
Right.
which
So it's up to them to respond accordingly based on what you're telling them.
yeah, that and staffing, because the Arrive Together is not a 24/7 program at this point in most counties. And so like I know here in Union County, it operates, I think, from like 7 in the morning till 3 in the afternoon, or 9 in the morning till 5 in the afternoon. Some of it's funding, some of it's staffing. I know they would love to have it 24/7. And I'm hopeful that it goes in that direction. The other part of 988 that has not launched yet, but will hopefully be launching in the next 30 to 60 days, is something called the MCORT program, which is the Mobile Crisis Outreach Response Team. This is part of 988. If you think about it as a triad, it's somebody to call, somebody to come, and somewhere to go. And so the first part in 2022 is launched, which is somebody to call, which are the 988 call centers. The second part is somebody to come. And these are mental health professionals. It's usually somebody who has a background in psychology, a background in mental health with a peer, and we as a center can dispatch these MCORT teams to go out into the community. And they go out without police backup unless there is something that is determined that it's not safe for them to go without the police. So that has
Mhm.
not launched yet. It is coming very soon. And then the third part of that, um, part of what is incredibly distressing to people who are in some sort of emotional crisis or having suicidal ideation, is that they go to the hospital and then they get stuck in this cycle and get stuck in the hospital and get stuck with bills, and all sorts of things happen where it wasn't really necessary for them to go to the emergency room. And so the state of New Jersey is creating stabilization centers within communities. So instead of going to the emergency room, you can go to a stabilization center, and there will be psychiatric nurses and other professionals there who can evaluate the individual. And if they need to be hospitalized, then they can be hospitalized. But if they don't, they can be provided with services, with medication, with whatever it is that is determined is going to help that person.
That's phenomenal.
Yeah. Well, New Jersey is pretty amazing in terms of services. It's I think part of what makes the journey really difficult is there are all these amazing services, yet people don't know how oftentimes to find them and access them. But we do have great services here. Um, Part of the reason why the state of New Jersey has either the lowest or second to lowest suicide rate in the United States is because we have great services that people do have access to. Um, but the other thing too is having eyes on each other, having people, oftentimes when I ask this question, people always go like, "Oh, well, the highest suicide rates have to be in New Jersey or New York because we're all crammed in together and making each other you know, just, crazy. And it's actually the opposite. Um, Having community around you is a protective factor during someone those moments when they're having ideation or they're escalating. Having people around you actually helps keep you safe. And it's part of the reason why in 2020, one of the reasons why we saw a drop off in the suicide rates. Because think about it, we were all crammed in together and all three of my adult children came home. It's a protective factor as well. So I applaud the state of New Jersey. I wish it was more efficient. But I do think 988 has created a space where people are really starting to talk to each other and figure out how we can do this better.
Mary Claire, so we're getting a lot of questions, I think,
Yeah.
kind of through like on the same topic. So just to clarify, I guess like the differences or like situations um, in which like you might like potentially like make a referral out to a like a psychiatric emergency screening service like versus calling like when you say emergency services, I assume you mean like that's like an ambulance and like a police officer.
Right. So
Okay.
in the state of New Jersey, for an ambulance to go out, the police have to go with it.
Right.
So everything is dispatched through the police station, and if an ambulance is going, the police are going with them.
Right. So now are there situations in which like you might make a referral to like a
To
psychiatric like screening service as opposed to like emergency screenings for
100%.
EMS? Yeah.
100%. So in the state of New Jersey, and Daniel, this gets back to, we have a lot of services, right? So we have these mobile crisis teams that are going to go out, and one of the things that they can do is they can do an evaluation and, help you figure out if going to the hospital is the appropriate thing. Um, but what we also have historically had in the state of New Jersey, we call it PES, which is Psychiatric Evaluation Services. In some counties, those services will push out into the community. You can call, and PES will come out to do an evaluation. Just so you understand, PES does not go out by themselves. They always go out with law enforcement. So you're not getting evaluated without there being a police presence. Um, those individuals, the way that is done though is that you arrive and um, the law enforcement folks take a step back and observe. Um, and now what's happened with Arrive Together is a lot of those PES folks are now part of the Arrive program. So the folks at Trinitas here in Union County are part of that Arrive Together program here in our county. Um, we we do not call PES on a caller's behalf. And the reason that we don't do that is they're going to start asking us questions about things that we don't have answers to. So it just simply makes more sense for the individual who wants to be evaluated to call that service themselves. If somebody is in crisis, it can take anywhere from, it's really sad, it can take anywhere from an hour to an hour and a half for psychiatric evaluators to show up. So if somebody's in crisis, we're not waiting for PES to arrive. In some counties, PES is embedded in the hospital, and so you have to get there anyway. I think I know here in Union County, it's Trinitas will come out. Overlook has it embedded in their emergency room. Newark used to go out. Now you have to go into the emergency room. So we have people call themselves and figure that out.
And then maybe you don't know the answer to this one necessarily, but these mobile crisis response units that don't have law enforcement involved, is there like a timeline for
Yeah.
this?
Yeah. So, and again, I just want to clarify, they try to not have a police presence, but if it's determined that, um, that there is a safety issue, then they may call, they may connect with law enforcement in their area. Um, and their mandate is to be somewhere within the hour. So what will happen is, and mobile crisis can only be dispatched through the 988 centers. So you as an individual can't call and request mobile crisis. You can call psychiatric evaluation services and request that, but you can't call mobile crisis and request it. You have to do it through 988. And we we again will stay on the phone with that individual um, for a good chunk of that process until we have to get off because mobile crisis then calls the individual when they're on their way because they're calling to say things like, you know, is there a better place for me to park my car? Which door would you like me to come in? Do you have any pets in the house? Can those pets be secured? Are there other individuals at home? So they'll have a whole host of questions that we ask, but then they will ask those questions again.
Gotcha. Thank you very much. That's very helpful. Um, okay, so I'm trying to sort through the questions here because
Okay,
we're getting a lot coming in. So there was one earlier that I'm going to try to maybe go in order here. Um, there was one that said, do you have volunteers that speak languages other than English, or when you receive calls, are you able to match them with a culturally responsive volunteer?
sure. So there is a translation service that is available through 988 that we can that is open to us and free to us. So I will say in the 7 years that I've been here, we have personally never used that translation service. I think part of it is because a lot of communities um, feel marginalized, feel that this isn't a service that is available to them, worried that they're going to call and nobody can speak their language. And so the state of New Jersey is really working hard to push out information that there are services or there are folks here that can help you connect um, and translate the conversation back and forth between my volunteer and the person who's called. What we do have happen oftentimes is we will have somebody call on behalf of the person um, who's in crisis and may not speak English. So we'll have a child who's called because their parent is struggling and they will act as the intermediary. So the service is there. Um, we just my organization hasn't had to use it. And then as far as we are a diverse organization, um, but I would still say probably 65 to 70% of the folks that answer the phone look like me. Um, but we have really tried in the past 3 or 4 years to make sure that we represent people in the different communities in New Jersey that are calling us. So we're working hard at making that happen. The other thing, and if you have folks that speak Spanish, when you call, I guess I should back up and say, when you call the Lifeline, you get a recording about where, that you've called the Lifeline and that they're going to connect you with somebody who's going to be able to help you. The first prompt is that if you speak Spanish, you can be connected immediately to the Spanish hotline. The second is that they can connect you to the Veterans Hotline if that's what you wish. And then there is a connection to the Trevor Project, which is for younger individuals in the LGBTQ plus T plus demographic. And so those are the original prompts that come up when you call. Um, and getting back to the data collection piece, really the focus of our time with a person on the call is about what is happening to them as a person. And we want to hear your story, and we are willing to sit in a place of non-judgment and hear what it is that you're calling about that day.
Thanks, Mary Claire. So scrolling through here, I think a few of these questions are kind of under the same umbrella of, let me see how I can kind of put these together. So I think there's like a lot of concern about just, again, like law enforcement involvement, like kind of, I mean, as we know, a lot of our community has been kind of mobilized here by the Victoria Lee
Yep.
killing. And so I think there's just in general, like this kind of, distrust and this kind of fear of law enforcement being involved. And I know that you don't speak for law enforcement, necessarily, but just from like a 988 standpoint,
Sure.
I guess like, do you have thoughts on like how things have maybe like shifted or like efforts that are being made, through like these crisis response teams that would kind of maybe try to address some of these concerns or just as like a response to the general kind of
Yeah, and I can't,
right,
I can't speak for them. I understand why. I
of
think it
course.
is in direct response to communities of color, to communities where people feel underrepresented, that that they are treated differently, and
Absolutely.
um, and the fear is there, and the fear is legitimate, and we hear it on the lines when people call us. Oftentimes, it will be the first or second thing out of somebody's mouth is, "You're not going to call the police, right?" And what I will say is, we never say, "No, I won't call the police."
Right.
Um, what we will say is, "I want to hear your story. I want to hear why you're calling me today. And if you and I can come up with an agreement to stay safe, then there will be no emergency services
Right.
involved here. If that's not okay with you, you're welcome to hang up, and I'm not going to call anyone. I'm not calling the police and saying this person called and they are in emotional distress. Even if you say I'm suicidal, I don't want you to call the police, and I say I can't guarantee that, and you hang up, I'm not calling the police.
Right.
It has to be somebody who is at imminent risk in
Mhm.
order for us to make that call.
Right. Right. Thank you. Um, Let me scroll through here. There was a good question before that I saw. Just going in order. We have a question that says, I feel like this type of public service should be covered by the state. It's interesting to rely so heavily upon volunteers. Is there any budget advocacy happening that people can support to get funding?
Sure. So in the state of New Jersey, there are four call centers. There's Rutgers Behavioral Health, which is the 24/7 responder in the state of New Jersey. They answer close to probably 50,000 calls a year. They are funded by they have been funded by the state of New Jersey for, probably the past 25 years. There is the Mental Health Association of New Jersey, who actually they answer less calls than we do, but they have funding from the state of New Jersey. And then there, and so both Rutgers and the Mental Health Association of New Jersey have paid individuals doing this work. So they have people who have, 40-hour-a-week jobs where they go. I'm not saying they're on the call, they're taking calls 8 hours a day, 5 days a week, but they are doing work around calls. So it might be follow-up calls that they have to do. It might have some other pieces of work, but those folks answering those calls are full-time employees. There's a very small center in Mercer County that does mostly texts and chats, and then there's Caring Contact. We have always had a volunteer model. We do get, I'm going to call it a stipend because it's not really real money from the state of New Jersey. We're hopeful that this year we will receive additional funding from the state of New Jersey just because the asks of us in order to now participate in 988, it's my job is entirely different than it was 3 years ago. But we do have an amazing development director who works with foundations, other civic organizations, individuals. And I just really appreciate this question and your concern for us. I think it's, research shows that people who speak to a volunteer, the level of anxiety is much lower after they get off a call when they have spoken to a volunteer as opposed to a full-time person who's doing this work. My people don't tend to get burned out. If you're working 8 hours a month, even 12 hours a month, the chances of you getting burned out are much lower than somebody who's doing this work 30 or 40 hours a week. And I just want you to know also that while the focus on answering calls is certainly important, the other part that's really, really important to us is the quality of the call. So we listen to calls, we debrief with our volunteers to make sure that they're doing the work appropriately and providing that caller with the right information and the right supports. The caller is the most important thing to us. And so we spend a lot of time listening to calls and making sure that people are doing that work. And so, as a volunteer opportunity, I think these people are just amazing. Who gives up, 8, 10, 12 hours of their month to go and sit with somebody who, again, it might be the darkest day of their life. It takes a very, very special person.
Right, absolutely.
And we have a volunteer training that starts later this month and again in September. So if anybody is interested in doing this work with us, I'm more than happy to have that conversation offline.
That's great. And from my limited experience with some of the staff at Caring Contact, I know that I had some initial, interactions. They are really wonderful. So I can definitely echo that. Um, I'm going to take one more question for right now. There are a lot that went unanswered in the chat, just for time's sake. Um, and then the rest, we will answer as like a follow when we send the resources as a follow-up, just because there's just no way we're going to get to them in the last few minutes that we have. So just one last question for you, Mary Claire. Someone said, I'm wondering if there will be different experiences among volunteers when they interact with Asian callers compared to non-Asian callers. Among Asian callers, are they looking for just sharing concerns or concrete resources to connect with language match professionals? This could be from like your personal experience or like if you have like staff members or volunteers who have, had interactions that can maybe speak to this. I don't know how much information you would have if people aren't
Yeah,
disclosing their ethnicity, but
yeah. We really haven't.
mm,
I think that again, I think that part of the issue is that people from your community aren't calling us. And we, and I'm going to use the big we, meaning the state of New Jersey, needs to do a better job with that. When people, when my volunteer staff has had conversations with communities where perhaps English is not their first language, we take our time. If we don't understand what somebody is asking, we clarify. Like we don't rush through. We don't say the service isn't for you. But again, our organization just hasn't really had that issue. And if somebody's talking about something that culturally I might not understand,
right.
part of active listening is asking questions, right? So, when you say that this is what happened. Can you tell me more about, you know, what happened or why that happened? So we can have a better understanding. And again, our job isn't to fix, our job isn't to figure out what you should do next. Our job is to really
Right.
listen to you and provide that space. And so oftentimes with really anyone who's calling us,
Hmm.
that is that's the service that we're providing. I will say that very few of our calls are people who are, standing on a bridge or sitting and have a container of pills. Um, we have people who call who are um, clearly in distress, who are sobbing, who really need our support and to be heard. But they are not in imminent danger.
Right.
Um, we need to help them to create their own safety plan. So what makes sense for them in a way to stay safe, we work with them to do that. So, when I say that, what I mean is, especially as a parent, if I'm talking to a child, my first instinct would be to say, hey, do you think maybe we can get your mom in here? Or, hey, do you think, you could take this information back to your mom? And oftentimes, kids who are calling, the parent is the issue. So, and not oftentimes, whatever time, right? So it's not for me to assume that the parent is going to be the person who can help in this situation. I need to be quiet, and I need that person to tell me um, what their safety plan is, what's going to work for them. And culturally, I think that goes as well. You know,
Right.
everybody has a different perspective on
Mhm.
who that safe person is in their community that they can reach out to.
Absolutely. That puts us right at 12:59. Thank you so much for being here.